All right, we're going to talk about things that I hear people mention and kind of deal with pretty frequent, and that's lower back. Um, a lot of people deal with low back tension, low back discomfort, chronic low back issues for all kinds of different reasons. And there are several things that we can do to kind of help and support that. So the one thing that I would definitely encourage is posture. So if you're sitting down and your back is like flexed forward, or like you're at a desk, you're in an office chair, anything like that, or in a car, and you're like forward like this, that puts a lot of pressure. If you're at home and you have a really soft, squishy couch and you sink into it like this, you want to support the low back curve. And so when you sit down, you should have something that's supporting that lower back, and you should keep your shoulders over your body, not in front. So be really mindful of your posture. For us, one of the biggest things that we really focus on is, are you balanced? Are your hips actually even? Or are your legs even? A lot of people have a pelvic tilt where they're unlevel. And most people don't even know that's happening. It's 1 degree, 2 degrees, so it's not a huge amount, not enough to where you actually know that, but it is enough that it creates abnormal pressure and force in your back. And so what we see with upper cervical is we know that when we have proper alignment here, we see the pelvic and hip position stay in a level position. And that's incredibly important for your lower back. So yes, even our focal point is upper cervical as far as adjustments. We see a ton of patients who deal with low back because we need to keep that spine in position. Now, one thing that you can do if you're dealing with low back is one of my favorite, simplest things to do to help ease the pressure is, like in bed or on a carpet, lay on your back, take your knees, pull both knees up towards your body, keep your head and upper back just flat on the surface of the bed or wherever you're at, but just pull your knees up into that kind of knee tuck position. Hold it, just hold it for 30, 40, up to 30 to 40 seconds, up to maybe even a maximum of a minute. And then you can let your legs down and you can bring it right back up and do that a couple times, or even let one leg down and keep one leg up. And that's a really gentle, easy way to release some pressure into your back. So as far as like a simple stretch you can do, you can definitely do that. So watch your posture. If you even question for a moment that you have a pelvic tilt, or please come in and let's check that and see if you actually are level or not level. And do some stretches and mobilization for that lower back.